The air quality in our homes, workplace, and public spaces has a profound impact on our health, well-being, and even productivity. This presentation will explore how poor indoor air quality contributes to serious health issues and how addressing it can enhance not just our comfort, but also our efficiency and overall quality of life. Okay, my discussion is going to cover the following topics: global indoor environmental problems, the effects of poor indoor air quality, and strategies for creating healthy indoor environment. And last, we can question and answer session to conduct. Oh, yes. Global environmental problems. Then you can see here there are a lot of environmental problems. You can see these pictures of silent killer. The silent killer, WHO announced this report, the silent killer. In 2019, 99% of the world population was breathing air that didn't meet WHO standards. Every year, around 7 million people die from exposure to polluted air, both outdoor and indoors. Household air pollution alone caused 3.2 million deaths in 2020, with 2.3 billion people still cooking over open fires or inefficient stoves. This kind of exposures leads to serious diseases like a stroke, health problems, COPD, and even lung cancer. Therefore, we need to consider our indoor environment then past. Then we discuss the global problem of poor indoor quality and its severe health impact. This slide, you can see several publications indicate that not only outdoor air pollution cause for the death in the world, the WHO and Institute for Health Metric and Evaluation, both studies, and you can see here another two studies also mentioned that indoor air pollution is the main problems for the death in the world. And now I will move to the death due to the indoor air pollution around the globe, the distribution. This best shows the percentage of deaths affected by indoor air pollution globally. Darker blue area, mainly in sub-Saharan Africa and South Asia, represent the highest percentage, highlighting the use of solid fuels like wood and coal. Lighter areas such as North America and Europe indicate lower impact. Clean energy. This emphasizes the need to talk about indoor air pollution in high-risk region. Not only that, here you can see this highlights the key terms and concepts associated with indoor air pollution and indoor air quality. These word clouds give us a visual representation of the major factors, sources, and impacts of indoor air issues. Then I want to discuss with you pollutant lifespan, sizes, and morphology of indoor pollutant. You can see it's how much serious. Actually, carbon dioxide, you can see here, their lifespan, lives 300 to 1,000 years in an indoor environment. Then you can see another pollutant also. They live long and their size is compared to the other pollutions. It's also can harmful for us. Therefore, we need to consider about the indoor environmental quality in the our Sri Lankan context also. Let's discuss why indoor air quality is becoming more of a problem than ever before. This slides highlights some key reasons and a statistic to understand the scales of issues. Then you can see here adults indoor activities. Then you can see here 21 hours per day. And children, you can see here 3 to 11, 19 hours per day in an indoor environment. It's a very serious. Then you can see here outdoor activities, very less activities. Then you can see. But you can see here indoor air quality is a growing concern because we spend 90 of our life time. And where air can be more polluted than outside. Many research found that indoor air pollutant is higher than the outdoor air pollution. Homes and effects may contain over 900 pollutions, and maintaining air quality is becoming more complex with the complex lifestyle. With so much time spent indoors, improving indoor air quality is essential for our health and well-being. Then we can divide three categories: indoor environmental quality, biological pollutant, chemical pollutant, physical parameters. For example, biological pollutants like bacteria and molds, chemical pollutants such as carbon monoxide and formaldehyde, and physical parameters like lighting, noise, and thermal comfort. These factors directly impact indoor air quality, which is crucial for health and comfort. Improving indoor air quality involves controlling pollutant sources and implementing proper ventilation strategies, actually. Then I wanted to discuss with you not only the global issues, indoor environmental related problems in Sri Lanka. Then here I have mentioned several problems. Actually, when I do my PhD, I found very less findings and studies in Sri Lanka. Then we need to focus in indoor environment research in university level and scientific level. Some studies we can identify only on the questionnaire survey. We don't have measurement data. Therefore, we need to go on measured data to identify the indoor environment and quality and problems and issues. Then we will move to the one by one. First, I will move to the discuss the building design and indoor air quality. Then, the energy crisis of the 1970s led to energy efficient buildings in the world, but many had poor ventilations. Features like sealed windows, lack of smoke extractors, and emissions from cleaning chemicals, building materials, and furniture contribute to poor air quality. Additionally, construction material often contain harmful chemicals, and controlled environments can limit airflow, further affecting ventilation. In many countries, face this problem in Sri Lanka. Actually, we need to identify this problem when we build the house. Nowadays, in urban areas and rural areas both, people are designing houses without chimney or, without any smoke extractors. It's affect to the indoor environment. We need to aware the people in the past, our generation use these things for their house to protect the indoor air quality. But today we don't think about these things. We are making our house very beautiful, comfortable, but when we test the environment quality, it don't have the quality. That's why we want to talk about this information. Then I will move to the next. This is the indoor air pollution sources. You can see very beautiful house, very comfortable. There are a lot of goods and stuff. Then we also have, and we think we are comfortable. We are healthy. We have clean house. We clean it every day. But you can see how many pollutant with it. How many pollutant with it. Everything have chemical and PM particles and several other pollutant. I told in the previous 900 pollutant can found in the indoor environment. Therefore, we need to consider about these pollutant and indoor air sources to create or emit the pollutant. Especially in rural areas in Sri Lanka, we still use firewood for cooking without proper ventilation. Smoke gets trapped inside. It's the same with mosquito coils and incense sticks we burn in our home for our protection. But it's create a lot of problems for us. It's create lots of problem for us. Therefore, we need to think about our indoor environment. This can cause breathing problems, asthma, and even lung infections. Therefore, we need to consider about this situation in the indoor environment. And I want to show this picture, then you can understand what are the indoor pollutants. Dust, mold, dust mite, pollen. Then what happened? You can see the one picture is with this slide. Green tree can brown. It's mean people also can unhealthy. Therefore, we need to understand the indoor environmental situation in Sri Lanka. This slide compares indoor air pollutant in developed and developing countries. In developing countries, pollutant is often caused by the use of solid fuels like wood and coal for cooking and heating, leading to significant smoke exposures indoors. In contrast, developed countries face pollutant from modern appliances, cooking emissions, and chemicals used in cleaning and materials. Both scenarios highlight the need for better ventilation and clean energy solutions. This is the modern society home and the rural area. In Sri Lanka, we have experienced this. Therefore, we need to consider about this. And I want to discuss with you households air pollution experience, previous research. This case study shows very important information. The first case study in the state household. When the cooking time, you can see here carbon monoxide and PM is getting high. And second study it was in urban residents. Then cooking time, PM concentration is getting high. Therefore, we need to know and we need to understand Sri Lanka indoor air quality. Actually, we think our environment is more clean. We don't have any pollutant. We don't have any problems in the environment. But you can see here these two case studies show very clearly. Then I got from the Sugatapala preference. And you can see this is the another study. I did it in university for my PhD study. I measured carbon dioxide concentration in the room environment, the student dormitory, student hostel. Actually, you can see here in the morning to night, midnight, and to another day morning, 7 to 7. I measured CO2 concentration. Here I included two dormitories. Then you can see here the early till midnight, the carbon dioxide concentration particle per million below the 1000. But you can see here in the night time what happened with the crowdness. In the hostel dormitories, there are a lot of students. At that time, most in Sri Lanka, in the night, we close the doors and windows. In the modern building type, they don't have louvers. Sometimes the students have habit to close all the open. They close all the opens, louvers and everything for their protection, privacy and everything. Then you can see here, carbon dioxide concentration getting high. It's a problem in the world, and the same studies conducted in Sweden, Bulgaria. They also found same results. The crowded dormitory pollute indoor air. Then this is the Chinese study. I want to show you the same results found in China also. That's why I told you, we think we are in the good environment. Our environment is very clean. But when we measure it, we can identify a lot of problems. Therefore, we need more research, more studies on the indoor environment and health in these tropical countries. Actually, tropical countries, its studies is very low. But in cool countries, we can found a lot of research. Then another pollution problem in the indoor, the smoking. Some parents, father or brothers, smoking in the inside. It's a very danger for others' health. Therefore, we need to give awareness for the people, the public. This is very danger for the others' health, and we need to avoid this from the society. And next I will move to the discuss mold and other allergens. You can see here. With Sri Lankan humid weather, especially in coastal areas, mold become a big issue. If there is a poor ventilation or water leaks, it only gets worse, leading to allergies. Actually, this problem, many public don't know. And many Asian countries. But in the developed countries, Sweden, Bulgaria, America, and China, they have conducted some studies to give awareness to people. Dampness, moisture, and mold is a problem in the home environment. People can get allergy. It can create the health problems. Therefore, we need to give this information to the people. Indoor environment, we can identify as the indoor environmental problem. This is the chemical exposure. This is another problem in the indoor environment. Cleaning agents, paints, and pesticides can cause a skin irritation and long-term health risk. Then you can developed and developing countries, both are facing this problem. In most developed countries, they know what kind of chemical used for the cleaning, paint, and pesticides. In Sri Lanka, actually, some chemicals, we don't know what kind of pollutant with it, or limit, or we don't have any standards for this identification. And this is the household materials. Consumer products, including soft PVC, contain phthalates. which are harmful chemicals. These are found in items like furniture, cleaning products, toys, food packaging, cosmetics, and baby care products. Phthalates are used to make plastic flexible, but can leak into the environment, posing risks to human health. This emphasizes the need for safe alternatives and awareness of chemical exposure. And this is the very another important problem in Sri Lanka in the indoor environment, poor ventilation. You can see here. With urbanization, unplanned urbanization, we have these type of homes, residential places. In crowded urban homes, there is often not enough fresh air, which makes people feel tired because of pollutants building up inside. Not only this noise pollution, lightning, there are so many problems with the low ventilation. Therefore, we need to consider this problem in the indoor environment. Indoor environment is more important because people are living more than 90% their life. Then we need to think what kind of environment we are living. Therefore, we need to keep it clean and we need to maintain the environmental quality. If not, in the future, we have to wear these kind of things to protect our lives. Then I want to discuss effects of poor indoor air quality. The first one, effects on health and comfort. Then immediate health effects, long-term health effect, and impact on comfort. Then I will move to the discuss immediate health effects. Then we can identify this immediate health impact, sick building syndrome symptoms with the poor indoor air quality. Then common symptoms we can identify: eye irritation, throat irritation, headache, and difficult breathing, fatigue, skin irritation. Poor air quality can also affect concentration and overall well-being. These effects emphasize the importance of maintaining healthy indoor environment. The sick building syndrome refers to the condition in which occupants of building experience acute health symptoms and discomfort that appear to be linked to time spent in the building, but with no specific illness or cause identified. And you know the special things. When we leave the building, these symptoms disappear. Therefore, immediate when the live with the poor indoor, that environment generate or that environment create the sick building syndrome. And then you can see here my findings in the PhD in the dormitory environment. I found prevalence of the SBS symptoms among the students in 2020. You can see here 11.3% students reported they have fatigue and 12.4% reported they have heavy headache. Therefore, this crowded environment, people are facing sick building syndromes. Therefore, I remember that one more study in the Japura University. It's also mentioned that the sick building syndrome symptoms. Therefore, we need to do more and more studies on it. Then you can see here 1994 gives the following poses as being the principles ones contributing to sick building syndrome. Building occupancy, low efficiency of ventilation, renovation using the wrong material, low level of facilities management, condensation or water leakage, low moral and lack of preconditions. These are the main things for the contributing to sick building syndrome. And these are the short-term effect and long-term health effects. You can see here the long-term effect because we discussed short-term effects. Respiratory diseases, cardiovascular diseases, cancer, and neurological disorders. You know, most time we think a lot of health issues come only with our food behavior. But here we can find there are so many findings on it. These long-term effects, exposure to the indoor air pollutant, people can affect these issues. And this slide shows the effect of indoor air pollutants. The one side I have to mention the pollutant, and another side you can see the effect. For example, formaldehyde, when the indoor environment with the formaldehyde, a skin stimulus, and lung cancer. Therefore, there are so many examples, pollutant and effects of the health. We need to do studies in Sri Lanka because very few studies with us to identify the indoor environment. And this is the studies of the prevalence of asthma and allergies in Sri Lanka. The first statistics was my study in 2020. Then you can see another places in Sri Lanka, Anuradhapura, Kelaniya, Gampaha, Colombo, Western Province study, and Gampaha. Then you can see here. These all studies present prevalence of asthma is very high. Actually, we don't know what is the main cause for this. We need to identify. That's why I am here mention indoor air quality studies we need. We need to study indoor environment. We need to identify what are the factors for this asthma problem. You know, there are a lot of studies in another country. They found what are the causes. But in our country, we found prevalence of asthma and allergies. But most time we don't know what is the exact factors for this. And this is another Sri Lankan studies of the indoor environment and health. And I wanted to show publication indoor environmental quality from 2011 to 2023. You can see here how many publications. 188,060. Very high publication. Most publication found environmental issues and association with the health problems. We also need to conduct the research. And second, I want to discuss with you impact on productivity, indoor environment quality, and impact on productivity. Poor indoor environment, how affect to the productivity? Then you can see here, thinking performance. Studies show that poor air quality, especially when there is a lot of carbon dioxide or VOCs, can reduce your ability to make decisions, focus, and even remember things. On the other hand, cleaning and well-ventilated spaces actually improve how well we think and perform tasks. And another factor is absenteeism. Poor indoor air quality can make people sick more often, which means they are more likely to take sick days. This, of course, reduces productivity for organization overall. Next, energy and alertness. When oxygen levels are low or polluted are high, people tend to feel more tired and sluggish. This makes it harder to stay active and productive at work. So, you can understand keeping indoor air quality is checked in isn't just about health. It's about performance, productivity, and well-being. And third one, mental well-being. This slide focuses on the connection between indoor air quality and mental well-being. Let's look at stress and anxiety. Poor indoor air quality can create discomfort, which often leads to stress. Concern about health risk from polluted air only add to this. And second one, mood and satisfaction. Fresh air, natural ventilation, and good air quality play a big role in creating a positive, welcome environment. These factors can enhance mood and improve overall satisfaction. Then, what is indoor environment quality? Actually, it's all indoor environment within the building, particularly in terms of its impact on occupants, health, comfort, and productivity. And it includes air quality, light comfort, thermal comfort, sound quality, odor quality, and vibration quality. To maintain this quality environment, we can address these strategies. The first, improved ventilation. We can use as a strategy, improved ventilation. Ensuring proper air circulation through the mechanical system or natural airflow is essential to reduce. Then we need to use clean the air. These devices can effectively remove dust, allergens, and harmful pollutants from the air, significantly enhancing indoor air quality. And we can maintain the indoor environment. Regular maintenance. It involves cleaning, performing routine dusting, and vacuuming to prevent the build-up of pollutants. A well-maintained system contributes to clean air. And we can control humidity in the indoor environment. Not only that, we can reduce indoor pollutants. And we can grow indoor plants. Some plants, very important to give fresh air. It can reduce carbon dioxide level in the indoor environment. Then we can grow these in the indoor environment. And personal habits. We can maintain or we can change our activities. For example, prohibiting smoking indoors and following instructions for household products can minimize harmful emissions and protect air quality. Sometimes we can open the window in the daytime and nighttime. We need to make the process for fresh air to come inside. Most of the Sri Lankan house close their windows in the night and doors. These all house built for natural ventilation. These all house built for the natural ventilation. When they close those all, what happened? We cannot get fresh air to the environment. When we make the building, we need to think how we can get the fresh air to the indoor environment. And we can identify and we can follow guidelines and standards. In the world, WHO, EPA, and several other certifications we can apply, and we can take these guidelines for when the building create, when the indoor environment changes. We need to think about these guidelines. Most of the time we do our things with on our pattern, on our thinking. But we need to think about the global findings and other kind of researchers, what they found. We need to consider about all these things. Then we can identify the indoor environmental problems. Then we can add new things, and we can create a lot of good building environment. And then you can see here Sri Lanka and China indoor air quality recommended guidelines. Then Sri Lanka, we have very few standards to maintain the indoor environment. But you can see here China, they have found more indoor environmental conditions and measurements. And I know there are several indoor environmental measurements in the WHO also. They have mentioned the limits for the indoor environment. We need to follow this. Sometimes international, sometimes locally developed limits we can use. Then we can solve our problems. And sometimes we don't have a lot of indoor environmental issues, but we need to check it. We need to more research and more studies. Then we can identify. Then thank you very much for listening for my discussion. If you have any question, I can give the answers. Thank you very much.
Thank you, madam. So now is the perfect time to engage with our audience. So if you have any questions, please feel free to ask them now. Yes, madam. I think there is no any questions. So
Yes.
before the wind up in the session, I have a small announcement for the audience. So this is the Associate Professional Training Program, which 50th is going to be start by next month, 18th January 2025. And the registrations are now open for the program, and the registration is closing by 30th December 2024. And the course fees is 40,000, and if there are any participant joining with group, they have 15% discounts. And also we are providing this time there is a golden jubilee offer for full scholarship. We are providing the 40,000 offer full scholarship for this golden jubilee offer. For the eligible requirements, we have mentioned in this flyer, and we have publish these flyers and the registration links in our social media pages and our website. Please go through with that. And if anyone interested, you can contact with this number. And if you have any clarifications, you can send the emails to these email addresses.
Hello, Miss.
Yes.
Actually, I went through the chat box, then two questions are with it. I want
Yes,
to
we'll
answer.
go with that, madam.
Yeah, I
Yes.
want to answer that. One question asks, where is it? Yeah. What is the biggest challenge Sri Lanka face in terms of indoor air quality? Actually, I want to tell in the rural environment, we mainly, in the rural environment, main problem is the cooking. In the cooking stove, we need to develop the proper indoor environment building and air pollution prevent method, then we can solve that problem. The main problem in the rural environment. In urban environment, we have indoor air quality problems a lot because I discussed these things, chemicals, and the outdoor air pollution also affect to the urban environment. Not only indoor, because outdoor environment also polluted. Therefore, we need to think this one. And chemicals and another factors like uh, the low ventilation create more pollutant in the indoor environment. Therefore, we need to consider about these things in the indoor environment. And another question also asks the air quality of the city urban area as a whole. As a whole, air quality, the city urban area as a whole. Actually, the urban area is a large area than the city. Both we can understand the indoor environmental quality problems can create with our attitudes and our environmental when we use the environmental materials and other things. Therefore, we need to think what kind of things we use, what kind of building we create, what kind of materials we use. It can create the indoor environmental problems. Therefore, we need to think more and more with the indoor environment because we are living more than 90% in the indoor. Okay, thank you very much, Miss. I saw these two questions.
We have some another questions. Is there any methods to measure moles on walls indoor?
Where is there any measures in Sri Lanka due to the recent Indian air pollution, especially in New Delhi? Those activities. I will answer this question first. Actually, you can see here, actually, Sri Lanka faced in several time with the PM level getting high. Uh, I know we have two measurements places in Sri Lanka to measure the PM level, Battaramulla and Kandy. And I saw another one private institution have several places to measure indoor environment, but we don't have any mechanisms to prevent any indoor environmental these issues. Actually, in government, in Central Environmental Authority, they have a very less information and measurements data with the with this PM level. We need, therefore, we need to focus these issues in the next. We can face in future. We can face a lot of these issues. And Miss, another question. What is another question?
Yes, the one of the person asking so many rules and regulations gazetted by CEA for eradication of open burning, but
Yeah.
mostly urban cities. How we can reduce those activities?
Actually, that is the problem when we read the information. And actually, this is the big problem in Sri Lanka, burning polythene and burning lot of things in the outdoor. Our waste also managing with the burning. Most of the Pradeshia Sabha and urban councils, they manage their waste with the burning. Actually, we have rules and regulation, but when they cannot stop that problem because of the some institution focus these things according to their own rules and regulation. They don't follow the CAE rules and regulation. We need to consider, I think the CAE rules and regulations for burning polythene is not enough. Police cannot take arrest the people, and they cannot punish the people. That's why people do again and again. This rules and regulation not actually act. Therefore, it cannot use for the actively minimize the problem. Yeah, when we actually, how can reduce those activities? Ask the corner. Actually, we want to give this information awareness to the people. A lot of people don't know what are the causes and pollutant, how it affect to the people and person also. One example I will tell you: most of the most of the rural environment, mother is burning polythene in their home in the morning, early in the morning. At that time, we close the windows and doors. These all pollutant circle in the around the indoor environment. This is very harmful to the women, children, and all of the occupant of the house. They don't know this is the problem. Actually, when I teaching and when I do the awareness session to the public, I tell every time I discuss this information. This information didn't go to the people. They don't know this is the issue. Actually, we want to give this information for the public. This is the very important things. Uh, another question, PhD energy. Then I wish to contact with you. Have seven contact with personal to hear from you. Thank you, administrations. You are correct. Yes. Thank you very much, Miss. I think I have given the answers. Some students,
Yes, madam.
yeah, some students are asking my contact information. You can give me my information. It's no problem.
Good
Yes,
evening,
okay.
madam. Good evening,
Yes.
madam.
Good evening.
Madam, I am Sanjay Ratnayake, chartered biologist. The thing is, actually, I have a small suggestion regarding that lecture session. Then currently, most of the people in Sri Lanka are reaching to Israel and any other countries as the construction laborers.
Yeah.
So, but they haven't any idea regarding the internal air quality or chemical pollution or any other things. I think it is better to inform regarding that matter before we are reaching that countries. Actually, this is my suggestion.
Yeah, thank you very much. When I do the public awareness, I will give it. Actually, sorry to say that some information we have done a lot of research and we have read a lot of things in the Sri Lanka and other countries. When we implement it or we want to give the people, sometimes we don't have a chance to give it. You know, it's
Yeah.
very difficult sometimes.
Especially sick building syndrome is very, very important because I think most commonly available situation under Sri Lankan condition.
Yeah.
But I think it is better to make some awareness regarding that matter before reaching for the Israel or any other countries as the construction latest.
Yes, yes. Thank you very much. Yes, that is very important.
Madam, one more question. Madam, one more question.
Yes, you can.
These apparatus to measure indoor air quality, are they freely available? Can we hire them to check our buildings?
Actually, building indoor environment quality, actually we don't have the pre mechanism in Sri Lanka. But we have some tools, we can buy some tools to measure the indoor air quality. For my research, I also bought several instruments. Actually, I bought the very standard level for my research, very expensive. That's why this research is very low and limited. This research is very expensive. But you know, you can use some internationally available app. You can use it for your mobile phone. Some countries have some small applications to measure the indoor air quality. When I was in the China, I use for my I check to the indoor air quality. Nowadays also I bought for my research. Therefore, I have to check my house. But I think it's very expensive. But you can manage it with the app and some devices, very less amount. How much particle in the environment? Is it better to go or it is better or risk? You can you can identify from it it's better or worst.
Now my question is, madam, for us to know whether our building indoor air quality is caused by poor ventilation or pollutants or carbon dioxide. How do you understand that? That's my question. Or are these apparatus available for the public to measure the buildings?
Actually, in the Central Environmental Authority, we can request and building one companies with Sri Lanka. I forgot the name. You can request to them, but it's not a pre-services. You have to pay for them. But in Sri Lanka, we cannot measure the carbon dioxide. Only PM level. You can measure the PM, particulate matters in the environment. For my research, I measured the carbon dioxide, formaldehyde, TVOC, and PM for my study. It's not available for the in CAE.
Last question, madam. What are the indoor plants which we can source freely to use in our building?
Actually, there are a lot of
pollutants.
we can use in the snake plants. We can use the snake plants in indoor because that plants give the oxygen to the indoor environment.
Snake plants. Okay, thank you very much, madam.
Madam, my next question. Hello.
Yes, I can hear you.
Madam, I'm Rajarata. Some people are telling some ideas about lucky plants, keeping the lucky plants inside the rooms and any other area. What is your idea regarding that one, madam? Is it toxic
Yes,
to the area?
actually, Yes, lucky plant. Time to time come several lucky plant. I don't know which one, which kind of lucky plant. The
Actually,
time to time come it. Actually, the snake plants. Kind of a snake plant. I saw it's several colors. We can use it in the indoor environment. It's very good for the environment because it's give oxygen for the indoor.
Madam is telling about Sansevieria or any other plant.
Yeah, yeah.
The lucky plants means, madam, actually glossy plant with glossy leaf and minimum number of leaves there. Actually, watery stem. Actually, I don't know whether what's the actual scientific name of the plant. Most of the people are telling this is the lucky plant. I think 10 or 12 leaf per pot like that. Some people are telling this is the lucky plant.
Okay.
And then some people are telling that it is toxic for the respiratory systems like that. What is your idea regarding that one, madam?
Actually, some plants. Actually, I didn't remember all the plants. Actually, I forgot to bring here. Time was 20:45. Then I couldn't to put the pictures of the plant. Some plant are toxics. Actually, not only toxics. It has pollen also. When the flowers are coming, it has pollen. If we keep in the inside in the fallen tar, I can tell it as with the flowers. We cannot keep in the inside of these flowers. Give the pollen. Pollen is also one pollutant. Therefore, we want to identify correct plant. What are the correct plant to the indoor environment? Without we don't use to indoor because
Okay,
it's very important.
okay. Thank you very much, madam.
Okay. Actually, some studies have done in the information is given in the chat box. CAE has done in the pilot investigation. Yes, that's nice to hear. Yes, we need these kind of studies to Sri Lanka to measure the actual situation in Sri Lanka in nitrogen dioxide and sulfur dioxide. You can see the indoor environmental pollutant is very the attention of the air pollution in the indoor environment is very less. Therefore, we have many pollutant in the outdoor testing, but indoor environment is very less limited. Yeah, biological pollution. Is there a biological indicators? Yes, mold and dust and dust mite. These are the biological pollutant. Yeah, other country actually in Sri Lanka we don't have these measures and these things. Biological indicators we can measure and we can identify. These studies have done in other countries.
Thank you all for joining us today for this insightful Green Talk. A special thank you to our esteemed resource person, Dr. Samila Marasinghe, for the sharing your valuable expertise and shedding light on such an important topic. And your insights have enriched our understanding and inspired us to take meaningful action. And to our audience, your active participation and thoughtful engagement made this session even more impactful. Let us take the knowledge we have gained today and apply it to drive positive change in our communities and beyond. Together, we can continue to campaign sustainability and work towards a greener, more resilient future. Thank you once again, and we look forward to seeing you at our next Green Talk. And we are uploading the recording in our Green Building Council Sri Lanka YouTube page. Thank you.
Thank you.